Well, good afternoon, everyone. I'm Dr. Paula Duren. I'm the Director of Universal Dementia Caregivers. And on Thursdays, we normally bring some topic related to caregiving or updates related to COVID. And today we're true to form. We have our guest today. He was with us once before, Doc Goodson III. He is the longtime vascular surgeon, physician assistant at BOMA. And first of all, I want to welcome you, Ro. Welcome back, and thank you for coming back.
Thank you. Thank you for having me. Thank you for having me.
And we wanted today to do an update because it came a few weeks ago when we were at a different place in the pandemic and wanted to just provide an update today to say, where do we stand? And I think it's especially important as we start opening up the state. And I was talking to him before the conversation started. I'm amazed at how many people are walking around as if there's no pandemic, the pandemic is over.
Yes.
Because our numbers are in check. If you're listening to the news and paying attention, the numbers are going up in a number of different places. And so I want to just start this conversation, Ro, by saying thank you again. But can you just tell us, should people start behaving as if there's nothing wrong anymore? There's no longer a virus?
Not at all. Not at all. This is not post-COVID. We're still in it. And you should still keep your guard up. You should still treat this like April, like we were in the pandemic. We are still in the pandemic. We're seeing rises in quote unquote hotspots, those areas in those states that have opened up pretty, couple of weeks ago and even a month ago. Those states are now increasing in cases as well as deaths. We're now reaching 2 million cases in the United States with over, I believe, 112,000 deaths. We had approximately another 950, almost 1,000 deaths overnight, since, I believe, since Monday or Tuesday. So yes, you should still keep your guard up.
Now, Ro, what are some of those states, if you could tell us, where the numbers are starting to peak upwards?
Well, I've seen South Florida, where the beaches are opening up there. Texas. I've even read about Arizona now being a hot spot. Arkansas. I saw Colorado. It was still, outside of the New York, the Detroit, the Chicago, those cities and those states and, Michigan itself. However, we've seen some new states. So those states are now on the rise. And I believe that's just because of everything opening up, those hot states with the beaches, the swimming pools and things like that are increasing the cases.
Well, and let's bring it even closer to home here in the Detroit metro region. Weather's changing. People are ready to get out. They want to just do the things, bring all their friends back into place. But the governor, even though they're opening things up, she's opening things up, she still has some restrictions. Isn't it like the number of people you can be around at any period of time? Like something like 10 or 12, or is it 100? I'm not sure. What are the numbers now, if you know?
Right. What I was told is that now you can, it started off at 10 or fewer, and now it's up to 100. But with those gatherings, you still need to social distance. You still need to wear your mask. You still need to, if you're symptomatic, you still need to go ahead and stay away. We have a lot of cases where people are asymptomatic and can be having the disease as well. So with that, just practice preventing the exposure of it should assist in keeping those numbers down.
And Ro, I think in the dancing community in Detroit in particular, the numbers were really high on the number of dancers that passed.
Yes.
And I received a notice the other day that someone was planning an event for this weekend. I hope I see another note soon that says that they changed their minds, because how do you social distance when you're dancing? And you might wear a mask, but dancing is all about the closeness and the connection and
Right.
communicating with each other, basically physically.
Absolutely. And even wearing the mask, you still need to practice that 6 feet of social distancing, which is impossible when you're dancing. And so hopefully you will get another text or email saying that, we've canceled it, or we will reschedule. But yes, we should still keep our guard up. We should still practice social distancing.
Well, I mentioned to you that I have a pre-existing condition and I'm a transplant. And that I went to the supermarket this week for the first time, for the most part, since March. I have made it very clear I'm not taking any risk on my life. I'm over 60, I'm 65 with as a transplant. I am going to control the part of this environment that I can, because I believe the disease is still here and there's no cure yet. My understanding, they're working towards it, but there's no cure.
Correct. That is correct. There's no cure. There's no vaccine. So yes.
Okay, now let's assume that we're going out. Now that they say we can go to the restaurants or we can do stuff, tell me the kinds of things that you believe we should be doing.
Well, first of all, I mean, as for me in my house, I have not been to a restaurant. Well, carry out, and with the carry out, I'll make sure I'm going in with my mask and even sometimes gloves. I don't touch the handle of the establishment when I'm going in. And with those companies or those bars opening up, those restaurants opening up, they say at 50% capacity. What I've seen on the news, those places were packed. And it's hard to kind of social distance yourself from another table when, you just have people constantly walking up to a bar or constantly walking over to you or past you. And you have people in that area coughing, sneezing. And even if you have a mask on, I mean, those droplets one person can affect 40 people, up to 40 people. And so
Wow.
I'm not actually participating in that right now. I'm still carry out, pick up at curbside, things like that. So,
well, and especially in communities of color. And let me just transition to that, because my question is, why is it that the numbers are higher in our communities? I'm sure there's a list of things, but when you think about that as basically a physician yourself, what's causing that?
Well, in our community, I believe it's limited access to healthcare. I mean, you have where we had policy and procedures in place some years ago with the Obama administration. We had insurance, we had access to healthcare, and with this administration we have now abolishing that. We decreased our limit to access, decreased our limit to healthcare. And so with that, you have socioeconomic restraints that come into play as well. And so I believe that it's just that whole limit to access of healthcare where we are struggling with, and it's affecting our community.
And I think in the last couple of weeks, we've seen people are starting to recognize the stress that's in our communities, and stress impacts your overall health, and your overall health impacts your accessibility or your immune system and your body's ability to really throw things off. So we have an appreciation that the virus is still there. We are not past the virus.
Right.
We have an appreciation that we need to be cautious.
Yes.
The community's opening up. Tell us some things we need to do. If you were going to give us 3 things, if we walked away from this conversation with only 3 things, what would you want us to hear?
I would say continue to, again, I say this all the time, keep your guard up, pay attention to basically how to prevent or how to eliminate the exposure of this disease. Continue to wash your hands, continue to wear your mask, continue to social distance, continue to limit your contact, your close contacts. I mean, my parents are still living. I love them dearly. However, I'm still trying to maintaining that distance from them. They did, they've been in the house quarantining for, isolating themselves for 3 months. I mean, however, they still went out and got tested, a couple weeks ago, and they were negative, but they wanted to make sure, and they ended up getting tested just because they wanted to help with the numbers. They wanted to help with just knowing they knew that they probably were not exposed. However, they wanted to get tested. And so one thing I would say is to continue to try to prevent that exposure. Number two, get tested. I know people are nervous saying that test hurts, but this is a basically 5-second or less discomfort, I should say, that could, save your life. And so with that, get tested.
Let me stress that, because it doesn't hurt. It's a mild discomfort.
It's discomfort.
I had the test done. I was going to Triumph Church because there's so many places that will test you for free.
Yes.
And there's no excuse in terms of access because people will provide the test. Yes. The one I had is they simply placed a long, you tell me what it is, with the cotton on the end.
Yes.
Swab.
Wow.
And they tested one side of the nose and then they tested the other side of the nose, but they pushed it as far back as they could, I guess, to get the right specimen spot. And that was it. It was over.
Correct. That was it. And just like I said, just a little bit of discomfort. But again, it gives you that sense of security to know, hey, look, I'm okay. But again, we need to have everyone tested. So
get tested. Be aware of what's going on in your own community.
And continue to social distance and wash your hands. If you don't have soap and water available, make sure you have a sanitizer close near, hand sanitizer with at least 60% alcohol.
Okay.
You have to have that. Those sanitizers, you have to make sure you have at least 60% alcohol content in that to help kill those germs.
And don't forget the mask, right?
Absolutely. That's I tell you, I look at people now without masks as if they had a mask on last year. If I would have wore a mask somewhere last year to a supermarket, you get those looks. Now I'm looking at people without them, like, why aren't you having your mask? So a face covering mask doesn't have to be a hospital issue mask or the mask that hook behind the ears, but some type of face covering to prevent those aerosol droplets and things like that.
And I've seen a number of people just put on bandanas, the little dollar store bandanas,
yes,
covering up the nose, but covering up the entire thing.
Correct.
Because I don't know if I've seen people wearing the mask below their nose and under their chin. I said, how about move it up over your nose and less under your chin?
Thank you. I agree. And I would like to express and stress the use of wearing a mask when you're driving. If you're driving by yourself, you do not have to have your mask on. I see people driving with their mask on, and we've had some instances where people have passed out driving and suffocated themselves while driving because they're wearing their mask. Now, if you're in the car and you're in, and you have someone in the passenger seat with you that are not, I would just say, you would put a mask on then, but if you're by yourself, I would not.
Okay. So if I were going to say what I've learned so far,
yes,
from my favorite update, Doc,
thanks.
is that seriously, the virus has not gone away. And if you listen to the news, and sometimes I know we want to get away from the news because we get sick of it over and over, but check in every now and then and hear what the specialists are saying. And they're saying that they expect another spike. And in some communities, it's already spiking. Continue to wear masks, be cautious. And if you want to remember, you're the best advocate for your life.
Yes.
I can't wait for somebody else to tell me the right thing to do. I need to make sure I'm doing it for myself.
Yes. And check on your loved ones. A simple call, how you doing, check on them. Even if you have to do a drive-by, you can do a drive-by at their home at the door, just saying, just to put a face to face, just saying hello. They can see you smile, but behind that mask. So
yes, they can.
Check on your loved ones.
And because most of the people we support are caregivers,
yes,
I want to emphasize to them that if your loved one is developing symptoms that you are concerned about, get them in front of a doctor as soon as possible. Or if you're finding that you're starting to feel that way, please go get tested. And if you're sick, you need to have a plan in place on who's going to take care of you, as well as who's going to take care of your loved one if you were to become ill. Doc, anything else you'd like to share with us?
No, that's all. I just appreciate you having me back on. I thank you so much, and I'll be talking to you soon.
Thank you very much. And it's a gift to have you. And I appreciate having your expertise here with us. And so blessings to you and your family. And thank you very much. And to all of those that watch us, if you have any questions of us, please feel free to give us a call, 248-509-4357. And we'll be very happy to be of assistance. Thank you.
Thank you.